Hello, my name is Dr. Rafael. I'm a cosmetic physician from Sydney, Australia. Today I wanted to talk about fake looking lip fillers because I feel that fake looking lips are what scares the public the most from getting fillers done for the first time. It creates this idea that fillers always look unnatural, which isn't true. It really sucks because fillers can be such a great tool for combating the signs of aging and improving the balance of facial features. Done well, it shouldn't be obvious that you have any fillers in your face at all. Studies show that after the eyes and the nose, the lips is what we focus our visual gaze on the most. This means that anything abnormal will be very easy to spot because we're so focused on the lips. It means it's really important to respect the normal anatomy of the lips when it's being injected. So let's discuss what is normal, starting with the Cupid's bow. That's the V that you see at the top of the upper lip. A classic sign of poorly done lips is that the Cupid's bow flattens out. It could be due to too much filler, so the lip stretches out like an overfilled balloon or a sausage. It could also be due to bad technique. But when I inject, I do it in a way that accentuates and maintains that V. Another thing that happens with overfilled lips is that the skin stretches out so that the natural wrinkling of the lip disappears, and that makes the lip look more firm and plastic and fake. So running from the nose to the peak of the Cupid's bow, we have philtral columns. And it's really important that if we're making the lips bigger, we also work on the philtral columns, because bigger lips without matching philtral columns will just look unusual. We should also think about the tubercles of the lips, which are the natural bulges of the lips. We typically have 2 in the lower lip and 3 in the upper lip. But a lot of people don't have much of what's called the medial tubercle. Some people have what's called a keyhole instead. And it's really important that if we're filling the lip, we don't add a medial tubercle in someone that doesn't have much of a medial tubercle there. So this is a model that I filled recently, and you can see she's got a keyhole, and so when I filled her lips, I made sure that I maintained that keyhole. You're not going to be able to take someone with small lips to enormous lips without them looking fake. That's because we only have so much room to work with in the lips, and if you're pumping them full of filler, it's more likely to spread to the area around the lips. It's called filler migration. You can imagine an area that moves a lot like the lips, it's even more likely to spread. So I call it Homer Simpson lips because the area around the lip looks really puffy. Not to mention that with such high volumes of filler, you risk squashing the blood vessels under such high pressure and compromising the blood vessel supply to the lips. And it can lead to something called necrosis, where the normal lip tissue starts to die. In someone that has lips that are really flat, it's especially challenging to increase their height without causing them to bulge out and look like duck lips. Most injectors will just go in and add volume, but in doing so, you're more likely to create duck lips. So technique is really important. Using thicker fillers that are more structural, we can add columns of support that increase the height while maintaining a natural looking shape. It's commonly called a filler lip flip, but there's a huge variability in the way this is done. In someone that just needs a bit of volume, thin fillers are better because they'll keep the lip feeling soft while maintaining their shape. It's also really important to consider the racial differences in lips. For example, in Caucasians, you'll have an upper lip to lower lip ratio of 2 to 3 when we're talking about height. So a common tell of a fake looking lip in a Caucasian is that the upper lip is as big or bigger than the lower lip. In Middle Easterners, their lips tend to be a bit bigger, but the ratio of 2 to 3 is usually still preserved. In Asians and Africans, you tend to find that the upper lip and the lower lip are very similar in height. So I'm keen to make more educational videos in the future. If you found this one useful, I'd really appreciate your feedback, a thumbs up, a subscription, and let me know what you'd like me to talk about in the future.